16th, 2020. This is a specially called meeting of the County Commission to talk about ongoing county efforts in response to the COVID-19 health crisis facing our region and our country. So let's begin the meeting with the Pledge of Allegiance. If everyone please rise and join us in the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, so the main purpose of calling this special meeting of the Commission today is to talk about some additional efforts locally on COVID-19 related to expansion of community testing for COVID-19. So we've got a presentation that Commissioner Jasmine Beach Ferrara is going to walk us through, and a resolution that the Commission will be discussing. But there's also a budget amendment that the county manager would like to ask us to take a look at, which could include resources for additional planning around testing efforts, but also includes several other items. So I believe those are all the items we wanted to cover at the meeting today. Ms. Pender, is there anything else that you wanted the Commission to consider while we're here today? Okay, great.
So I just got a question from a procedural standpoint.
Yes.
So we called a meeting, we announced it. We're supposed to do that a week. We did that, right? Did we do that?
48 hours, yes.
48 hours. Okay. So, and it's on a specially called meeting. Do we have to post what we're going to be discussing? What's the requirement?
The notice was generally related to COVID-19. However, since all members are present at the special meeting, any matters that can be conducted at this meeting.
Okay.
So the budget amendment would be in order, even with the ambulance items, even though they weren't specifically noticed. It's appropriate to consider that business.
Okay. Thank you.
Right. Yeah, and obviously these are, we don't do special meetings very often. And I think in terms of the COVID-19, obviously this is just such a unique issue and is presenting such, unprecedented challenges to the region from a public health standpoint, from an economic standpoint. For myself, I thought, it would be timely to go ahead and have some discussion about these issues, just like we have in some of the other issues we've taken up with COVID-19. I think the county taking steps sooner rather than later has really benefited us, and just from time to time we might need to have special meetings outside of our regularly scheduled meeting every 2 weeks to make sure we're moving things along that we want to see work being done on, rather than always just waiting for the regular meetings.
Yeah, and I'm okay with that. I'm okay with that, Chairman. I just wanted to make sure that anything that we're discussing, that that to the extent possible, and that follows procedure, that the public is able to see it, they're able to react to it, they're able to ask questions, because some of the things we're looking at today, I didn't have a lot of time to spend on them. So
Absolutely understand.
And
Yep.
I'm okay with making decisions, quickly if if I have all the documentation, have the process, and I have everything. But I just want to make sure that the public has that, we're following a proper procedure, and so.
Yeah, no, I absolutely understand. And, so I think that today we'll be discussing several items. If the Commission is comfortable moving those ahead, we can do that. As with any issue at a regular meeting or otherwise, we can always take more time as we need to make sure we have all the information we need to feel comfortable making a decision.
Thank you.
All right. So I think I'm going to start off. I think the order, I'd suggest we take these in. Let's review the presentation. Jasmine will walk us through that. I'll be happy to walk through the resolution. If we are comfortable moving that ahead, we can go ahead and do that. And then Ms. Pender and her staff can walk us through the budget amendment issues. So I think that's the order we can take these up in. And so we'll get started. Jasmine, if you'd like to kick us off.
Hello, everyone. It's good to see folks. Briefly, before jumping into this presentation, which really is just a meant to accompany the resolution, and it was just recently finished, so I've just emailed a copy of it to everyone on commission. I apologize for the lateness of that, but I just want to briefly, first of all, just thank everyone on commission, county staff, especially those folks at the EOC and the Public Health Department for and a lot of community partners and local public health experts for sort of the combined efforts that I think have, in the last month, just done such a tremendous job responding to COVID and implementing the social distancing policies that do seem to be flattening the curve. There does seem to be some encouraging data around that. And also enabling us to begin thinking about what comes next, and enabling us to begin talking about how we move as safely but also as rapidly as we can towards the day when we can begin reopening both our economy and our community. And certainly as we have any one of these conversations, we're thinking about folks all across Buncombe County for whom this is such a real and concerning issue. Every statistics we reference has a person behind it. So we certainly hold our community and our thoughts and our prayers as we have these conversations. So I'm just going to kind of walk through this presentation. Max has queued it up on the screen, and commissioners should all have it by email if you want to reference it as well. If you have any questions along the way, don't hesitate to jump in. There we go. Let me get queued up there. Okay, here we go. So the theme of what we're doing here is really talking about how we continue to take action to both save lives and safely reopen our community on the horizon. At the core of that, there's a critical need for expanded COVID-19 testing. The strategies that we're talking about today have shown to be effective in places like South Korea, Iceland, and Taiwan, all of which experienced the crisis weeks and months before we did. And these are places that have been most successful in both suppressing transmission of COVID-19 and being able to resurrect and restore their economies and local activities. These are now being launched, strategies like this, in places like Massachusetts, Los Angeles, Utah, and many other cities and states across the country. It's important to note and keep reinforcing that everything we're discussing today builds upon the scaffolding of current efforts and includes continuing current strategies related to both social distancing and social services. Our goals, of course, are to save lives and to prevent, oops, I've got too many buttons in front of me. Our goals are to save lives and prevent serious illness, to ensure that our local healthcare system has the capacity to provide care to those who need it. That means flattening the curve to ensure there are adequate supplies of PPE and ventilators, and to safely reopen our local economy and community as soon as possible. As I said, what we're discussing today as we think about the next phase of efforts builds upon the work we've been doing in the last few weeks and even months. That includes continued social distancing measures and continuing to provide expanded social services, such as the One Buncombe Fund or free school meals. There are three new components that we want to talk about today. The first of these is planning to scale up and expand access to community testing, expanding contact tracing, and expanding access to isolation and care services for those who are positive. Another piece of this is expanding prevention and early detection efforts for individuals who are high risk and for communities that are vulnerable. And the final piece is beginning the planning process for how we can safely reopen our local economy and community. So I'll kind of walk through each of these just to get them all on the table. This first piece of expanded testing, contact tracing, and isolation and care really emerges from data from South Korea and other parts of the world that show that a rigorous combination of these strategies, the testing, the contact tracing, and providing isolation and care for those who are infected, can enable a community to reduce new transmissions and to safely begin to lift social distancing restrictions. And in that, to really have a good grasp of the evolving nature of COVID-19 in their community. We know that testing is really the best and only way to determine who has COVID-19 in our community. Testing has been and continues to be available in Buncombe County, and this includes the 2 drive-through testing sites that were offered for several days, and testing that's taking place in those places considered most vulnerable, such as continuing care facilities. Moving forward, what we'll be talking about today is how the county can prioritize the expansion of COVID-19 testing. We all know, of course, that first this requires tackling supply chain issues, which have plagued access to testing across the United States and locally. The good news is that new technologies and increased production are improving the supply, but it's very important to note that it remains a significant challenge to access testing supplies locally in the volume that we need. Next, this involves developing protocols for the types of tests to be used, when they'll be administered, and for whom they will be used. Testing will need to be implemented in phases as we have access to more supplies. Initial resources will need to be prioritized towards folks like medical professionals, first responders, people who work in essential businesses that require close interaction with the public, such as cashiers at grocery stores and staff in nursing homes, and residents of Buncombe County with documented symptoms of COVID-19. The next steps, as we look at how to begin moving forward, include implementing a new self-check program, which county staff are developing in partnership with MAHEC. This is a program through which residents with symptoms will be able to complete an online assessment and receive guidance about next steps, including testing for those who meet criteria. Just to spend a little more time on testing, because it's really at the core of what we're talking about. Current testing procedures require tests to be mailed to labs, and that takes several days for results. The new testing systems that are becoming available can generate same-day results, but supplies of these are very limited, and some are still undergoing validation. There's also a type of test called antibody testing that's being developed, which could identify who in our community has had and recovered from COVID-19 and may have immunity. These testing systems also require further validation and are expected to be supply constrained. So all of this is really just about a very clear-sighted assessment of the landscape, but also the challenges we face around accessing testing locally. Contact tracing goes hand in hand with testing. This is a process that identifies people who've been exposed, and it connects them to testing as needed, and as needed, treatment and safe isolation options. It's important to note that the county has been conducting contact tracing from the start for positive cases. The next step in this, which is already being planned, is to expand contact tracing efforts as more testing is conducted and more positive cases identified. Doing so would involve training more staff and scaling up current systems. I wanted to just share some case studies of other communities in the United States that are moving forward with these strategies. On the testing front, Los Angeles has really emerged as a place where we're seeing wide-scale testing happen. Last week, they launched a free testing program for anyone with symptoms involving both drive-through and walk-up sites. They're prioritizing folks who are over 65, those with chronic conditions, healthcare workers, and first responders. The tests that they're using are self-administered mouth swabs or staff-administered nasal swabs. Los Angeles was able to access these tests by purchasing them directly from a South Korean company. They bought 20,000 tests at a cost of $1.25 million. One of the issues that comes up in looking at the Los Angeles model is whether those tests have been FDA approved through their emergency process or not, and the decisions that communities face around whether to pursue testing models that have or haven't been approved in that way. When we look at contact tracing, the case study that kind of leaps forward is what's happening in Massachusetts. Also last week, Massachusetts launched a statewide contact tracing program working with an organization called Partners in Health. Their goal is to hire 1,000 people across the state as community health workers who will conduct and log contact tracing calls, enabling people to get access to testing and, as needed, publicly funded isolation. Just as a point of reference, Massachusetts at the state level has allocated $44 million to run this program through October, and they will soon be releasing a toolkit for other communities around the country about how they're scaling this up. As a quick side note, this is also something that North Carolina Department of Health and Human Services talked about in their press briefing yesterday, that they're working on ramping up across the state. The final piece of this three-pronged progression, testing, tracing, and isolation and care, involves providing access to isolation facilities for people who can't safely isolate at home or who don't have a home. This could be because people live with people who are high risk, or people don't have the ability in their home to have a private bedroom and bathroom, or people, again, who are experiencing homelessness. This free isolation model includes lodging, medical checks, meals, and other support services. And the great advantage of this is that it reduces the risk of transmission within families, households, or facilities. As we think about what's currently in place in our community, and our community's done an incredible job of following social distancing policies, the greatest risk that really remains is the type of risk happening at the level of congregate living facilities or at the level of households, particularly households where there are individuals who fall into high-risk groups. And expanding access to public isolation facilities is a way to help us tackle those pieces of the kind of risk puzzle, so to speak. The county, it's important to note, has been providing isolation services in small numbers and is preparing to scale those up as we move forward. A quick case study of this comes from Greeley, Colorado, a community of about 100,000 people that just designated a local facility for isolation services for folks who have COVID and can't safely isolate at home. They're doing this in an unoccupied 30-unit apartment building and have budgeted $200,000 for doing this. So we see both smaller cities, like a place like Greeley, Colorado, and some of the largest cities in the United States, really on the same page that I think we're headed onto here in Buncombe County, which is exciting. The other piece of this, just briefly, which again absolutely builds on the scaffolding of work that's underway, is expanded prevention and early detection for both high-risk individuals and vulnerable communities. As we think about all the people who live in Buncombe County, we know that there's some folks who are at higher risk of contracting COVID to begin with because of living in a congregate living facility, for instance. And then there's some folks who, if they contract it, are at a higher risk of becoming acutely sick more quickly. So a key part of this is about continuing prevention efforts and early detection efforts in these communities and doing it in a way that's equity informed. Just briefly, some of the communities we think about include healthcare workers and first responders, residents of long-term care and assisted living facilities. And what we're seeing from state and national data is that African American individuals are at a significantly increased risk both of infection and death. So we certainly want to think about racial disparities within the county and how to do focused prevention and early detection efforts with the African American community. We also think about folks who work in essential industries with a high level of public interaction. This is really just kind of walking through again why testing is such a critical component of our strategies moving forward. COVID-19 is likely to be with us for a long time. We can't get rid of it. And until there's a vaccine, we must carefully monitor and manage it. The number of actual COVID-19 cases is far greater than documented cases because of the low number of tests that have been administered, and because many people with COVID-19 have mild symptoms or even no symptoms, even though they can still transmit the virus to others. Without ramped up testing, it will be impossible for us to know if relaxing restrictions on business and social activities would risk accelerating the spread of COVID-19 to unacceptable levels. And simply lifting government restrictions will not restore the economy or community if people consider going out to a restaurant or attending church or sending their kids to school to be too risky. We have to make sure that our community members also feel comfortable re-entering the local community. And community testing will provide key data so that leaders and community members can make informed decisions. Finally, testing of employees in jobs with close contact with the public could be especially valuable for people to feel safe going back to these businesses. The next few slides I'll kind of move through quickly because really the focus of today is about how we fully commit to a strategy that puts expanding access to testing as a top priority. But quickly, as we think ahead about what would actually be involved in safely reopening our local economy and community, we think about establishing criteria for being able to reopen different sectors. Think about creating systems to provide guidance and technical assistance for sectors regarding reopening. And then also establishing protocols to monitor sectors that have been reopened and triggers for reclosures should those be required at any point. As we think longer down the runway, we recognize, of course, that our response to COVID-19 will remain a top county priority in the coming year and potentially beyond that time. Until a vaccine is available and we reach herd immunity, we must guard against the threat of new waves of transmission. Concrete steps we might consider in terms of mid and long range planning include a funding strategy for COVID-19 in the coming year's budget, systems for ongoing prevention and monitoring strategies, and also how we will plan for the mass administration of a vaccine when that is finally available. In closing, I just kind of want to talk about the regional context. Buncombe County is doing really tremendous work in response to COVID, and of course a virus doesn't respect county lines any more than it does state or national lines. So we want to think about the communities around us as well. And the fact that our efforts will be most effective when they're part of both a regional and a statewide strategy and even a southeastern strategy as we think about how close we are to other southern states. Just briefly to provide a snapshot of how COVID-19 is impacting Western North Carolina communities currently. This is data pulled from the state and then from Buncombe County on April 14th. Currently, there's a documented case count of 366 lab-confirmed cases across the 22 counties in Western North Carolina. That's 7.4% of all cases in North Carolina. There have tragically been 11 deaths in our region, accounting for 12.7% of deaths in North Carolina. And among those 22 counties, there are 5 counties that account for 280 cases and 9 deaths. Those are Buncombe, Burke, Cleveland, Henderson, and Rutherford counties. So again, as we think about what's happening at the regional level, we of course want to be, what we would hope most for is that Western North Carolina acted quickly enough and at a time when the case count was low enough that we have been able to significantly flatten the curve and that we are now positioned to really embark, again, as rapidly and safely as we can on the next phase of our efforts. We won't know a definitive answer to that question until we've done testing, both within Buncombe County but across the region, and really have a clear understanding of the scope of the transmission rates to date. This is just 2 slides that detail, or 1 slide, I'm sorry, that detail the kind of breakdown by county again from a couple days ago. And that's really the context and a bit more information surrounding the resolution that I'm going to turn things over to Brownie to walk us through. And of course, it'll be great to have discussion and conversation at the level of commission and then with staff if there's an interest in that as well. So thank you all very much.
Great, thank you, Jasmine. All right, I'd like to walk through the resolution that we have with us. I'm actually like to read it, but before I do that, just to share a few thoughts about, what's the purpose of considering this resolution. There are so many different aspects of the fight that we're involved in around COVID-19 that we're responding to. So many things have already been put in place. But and frankly, a lot of what we've been having to do over the last weeks, month, is really kind of the defense, right? Like we've had to turn a lot of things off in our community as kind of the main strategy for preventing the spread of this illness. We've had to stop schools, we've had to stop different business sectors, we've had to stop public gatherings. So a lot of it has been really using the tool we have to kind of keep everyone staying home and staying safe as a way to prevent the spread of this dangerous disease. And that will continue to be important as we go forward. We know that we're doing better. The number of COVID counts we have in Buncombe County is fortunately much lower than most other metropolitan areas across North Carolina and across the country. So we greatly appreciate everything that people in the community have done to be so responsive to that strategy of stay home, stay safe. But we also know that we can't do this indefinitely. We've got to move through this. so that we can reopen businesses, we can reopen our houses of worship and our schools, but we have to do it in a way that is as safe as possible, and doesn't undo the progress we've made in terms of slowing down and reducing the spread of COVID-19. And I know, we're all doing everything we can to kind of learn about this because it's such an unusual situation. None of us have ever been involved in an issue like this as county commissioners or members of the community in our lifetime. So, as we listen to our local health experts, when we try to look at what other communities around the country are doing, it's pretty clear that this community testing strategy is going to be a key component to how we move forward and continue to reduce the spread of COVID, but also allowing us to make informed decisions about restarting businesses and other community activities, because we'll be able to have a better sense of how much COVID-19 there is in the community. And as we provide more flexibility to businesses and community groups, we will be able to track in a way that we really can't now due to the limited amount of testing, whether the amounts of COVID-19 are starting to grow again in a way that's dangerous and exceeding the levels that we're going to be able to consider manageable in our region. So, from the county's health experts, I was fortunate to be on a call with Dogwood Trust this week. And the Dogwood Trust has really probably been doing more than any other institution in Western North Carolina around testing. They've made it a central focus and across all of Western North Carolina, not just Buncombe County, and they've done some really good things. But from the conversation with the officials with Dogwood Trust, it was also very humbling because they also pointed out how really difficult this is. Communities across the country and across the world are all competing for the same resources. A lot of these technologies are very much under development and are emergent. So as Jasmine said, some of them are proven technologies that have been around for a long time. Others are very new and are still going through different validation processes. So I think part of the purpose of this resolution is just for us to recognize as a commission that this is something that, due to the national shortage of these supplies, we've done some work in, but the scale of what's probably needed in the future is going to be great, and it's going to require sustained effort. So, and it's going to be a key part of our strategy. So, anyway, with that as context, I'd like to just review the resolution, and then we can have some discussion about it. One thing I'm just going to note, at the end of the resolution contemplated a budget amendment for doing some of the initial planning work around testing and initial implementation. But the county manager and staff have a budget amendment for us to consider for kind of the broader work around COVID-19 that needs to be done. And what Ms. Pender has said to me is that, some of the planning work and other things that need to be done in this area can be handled with the resources that would be included within that budget amendment. So I don't think we need to do a budget amendment within the context of this resolution, so we can take that part out. All right, but let me just walk through it. Resolution supporting expansion of community testing and contact tracing for COVID-19. Whereas the COVID-19 pandemic poses a significant public health risk with more than 640,000 documented cases in the United States and more than 30,000 documented fatalities. Whereas the elderly and individuals with chronic conditions are especially vulnerable. Whereas the ease of transmission and the rate of death associated with COVID-19 virus requires rigorous and sustained efforts to prevent, track, and treat the virus. Whereas the economic impacts of COVID-19 pandemic have resulted in more than 10,000 local residents in Buncombe County losing their jobs. Whereas Buncombe County took early action to slow the spread of COVID-19, being the first county in North Carolina to declare a local emergency, urging residents to avoid non-essential public gatherings and issuing a stay home, stay safe order. Whereas current documented cases of COVID-19 are lower in Buncombe County than most other metropolitan regions in North Carolina and the country. Whereas data from South Korea, Taiwan, Iceland, and other regions demonstrates that community testing is essential to suppressing COVID-19 while enabling the safe reopening of local businesses, schools, and community activities. whereas a nationwide shortage of testing kits and laboratory testing capacity have greatly limited the amount of COVID-19 testing conducted to date, and supply chain constraints are expected to remain a significant challenge. Whereas the Board of Commissioners seeks to restore operations of local business sectors, community organizations, schools, and other education institutions as soon as possible when it can be done in a safe manner, and community testing is an essential component in that process. Now therefore be it resolved that the Board of Commissioners of Buncombe County hereby as follows. The board requests staff to develop short-term and long-term plans for expanded COVID-19 testing in Buncombe County to include but not limited to frontline medical and first responder staff, employees in essential jobs that require a high degree of interaction with the public, such as cashiers at grocery stores, and staff in nursing homes and long-term care facilities, and residents with documented symptoms of COVID-19. B, develop protocols regarding the types of tests we will use and how they will be used with the goal of accessing COVID-19 tests that can provide accurate, same-day results while recognizing that tests that require more time for laboratory analysis may need to be utilized in the interim due to supply constraints. C, prepare strategies to secure access to antibody testing, which can ascertain which individuals have already experienced COVID-19 and may have immunity as the technology is scientifically validated and supplies become available. D, to continue and expand contact tracing. E, to provide isolation and care services for residents who are known to have contracted or have a high likelihood of having contracted COVID-19 and are not able to safely isolate themselves in their own home. F, to expand prevention and early detection efforts among high-risk individuals and vulnerable communities. G, to develop protocols for utilizing testing as part of an overall plan for safely reopening the local economy and community. And finally, H, to seek collaboration with entities including but not limited to North Carolina Department of Health and Human Services, local governments in Western North Carolina, funding entities, healthcare providers and systems, and community-based organizations. And then as I mentioned earlier, item number 2 can be deleted from the resolution, which is the, would have been a budget authorization, but we'll handle that discussion separately. All right, so commissioners, those are the contents of the resolution, and so I'd be happy to kind of pause there, and we can have some discussion. And once we've handled this, then we'll turn it over and we'll talk about the budget amendment, which can be related to this in part, but also includes several other items. So, any questions or thoughts from other commissioners? I appreciate everyone's consideration. Or if there's a motion, that could also start us off.
You want a motion?
Sure. That'd be
I
fine.
move that we approve the resolution supporting expansion of community testing and contact tracing for COVID-19
I
in
second.
Buncombe County.
All right. There is a motion and a second. Further discussion.
Yeah, I've got some conversation on it. And I really don't know where to start, so I'm just going to start and just say a few things and see where it ends up. So I got an email today on this. I saw the slide presentation just a few minutes ago. Been a commissioner for almost 8 years. That's the first time that to that extent I have been surprised with information. I'm uncomfortable with it. It's not how we do business. It's not how we operate. We have to have careful and calculated conversations, particularly in times like this. There are parts of it that I'm okay with. There's some of it that I am not okay with. But to come in and to see this morning, I actually saw it at about 11:30 because I was out of touch for a little bit and traveling, and actually read it on the way back in my car. And so that deeply concerns me. Now, I thought that we were going to have a conversation on what our next steps would be, which would include discussions not only about this and about the potential of testing and about the availability of testing, but also, updating where we are with our businesses, having some discussions regarding similarities between businesses that we might be able to, with state guidance, and see where they're at so we can react in Buncombe and see where we need to be. But I believe this requires a lot of discussion. I took some notes. I'm not sure where all the information came from in the slide presentation. Someone worked pretty hard on it, and I'm glad for that. But I'm not sure of the validity of all the information in it. There's certain places that are quoted, and I'm not sure that those sources are what we should be relying on. So the reason I asked at the beginning, from a procedural standpoint, if we announce that we're going to have a meeting within 48 hours, should this information have not been, and I'll go back to Mr. Frew again, should this information, if it is, it is very important, so I'm not going to diminish that, and I would love to have a long discussion on it, but should this information have not been included when we announced that we were going to have a special meeting to discuss next steps regarding COVID-19? Should this information have not been included in that at that time?
I think given that this, the very nature of a special meeting is to be called on short notice, and it clearly does not fall within the normal parameters of a regularly scheduled meeting, where we would have all agenda items to the best of our abilities readily available to the board and the community the Wednesday before the Tuesday, being 6 days in advance. So those rules aren't contemplated by statute or by rule for special meetings.
So can I just comment? I don't want to interrupt you, Joe, but I just want to say that I really appreciate your concerns, right? Like, the way that we are doing some things now are just not the way we are normally going to do stuff, I can't, you're right, I can't think of any other issue since I've been on the county commission where we've done something like this. But I also know that there hasn't been any time I've been on the county commission when, we issued a special order on a Thursday just like today that declared an emergency and put in place all these sweeping implications for the community. And I was very uncomfortable with us doing that. But you know what? I'm glad we did it, because we had that same issue on our agenda for the next regularly scheduled county commission 5 days later. And I think that with the nature of this COVID issue that we're wrestling with, time really matters, right? Like, the way it spreads, and it spreads so dangerously. I think the fact that we took action sooner, and different churches that weekend decided, hey, we better do something different instead of having everyone come together this weekend. And there were some different big community activities that were scheduled in Buncombe County that weekend as well. And the organizers said, we better not do that. So I think the fact that they made those decisions sooner, I think it provided benefits, and I think this this issue is similar to that. I think the sooner we can start thinking about how we begin planning around how do we start turning things back on, I think timing matters on that too. So I just want to say I'm also not comfortable with this for some of the same reasons you are, but I also think it behooves us to have these conversations and and kind of try to move these conversations forward. So I want to acknowledge your concerns, but also kind of just share why I think in some cases we're going to need to have special meetings and talk about things, but I do want people to feel like they're getting all the information they need to make a good decision on these important issues.
So that's what makes it really tough for me, is because, I'm not gonna be able to vote to support it simply because I've not had that opportunity to be able to discuss it. And I thought really that's what we were going to be doing. I wasn't expecting a motion to pass a resolution. I was expecting that we would talk through these things, maybe have additional ideas that we might want to add. The other was a little bit different than this. We had to make that decision. We had facts associated with that decision. We had state and national guidance associated with the decision. We had to make that move. It was difficult.
No, we didn't.
Well,
it was on the agenda for the meeting on Tuesday, and a decision was made to do it.
But we
on
discussed
Thursday.
that. We discussed that. I was comfortable with that.
I mean,
I
there
found
was
out
no-
about
there
it on
was-
Facebook.
There was no
So,
commission
just as a
discussion
piece
about
of
that.
context.
I had to make that decision outside of a commission meeting, and I thought it was the right thing to do, and I did it. But there was no process on that.
Well, I'm not afraid to do the right thing. You know that, and I know you're not saying that this is different, because what we're saying, and I would love to be tested. I'd love to be tested tomorrow. I'd love to be tested. I'd love to find out if I got antibodies. I'd love to find out that information. Is that available to me? Can I get that? I mean, a strategy of testing is not a bad strategy. I don't disagree with that at all. It's great. But one of the basic principles in management, whether it be business, and it may not apply to government, but it does apply, that you cannot just create strategy for the sake of strategy.
And if I could jump in, I'm happy to talk through any of the data in here, any of the reference points. And I hear you, process is really challenging in the context of a crisis and emergency. So just to fill in some of the dots, I finished this PowerPoint at, I don't even know, maybe 10:30 with 2 screaming babies and a 5-year-old who wanted to wrestle with me. So that was sort of the context of it. This wasn't something that's sort of been sitting on the shelf. But I certainly, think it's important for us to be discussing it. But I do think that there's really univocal recommendations that scaling up testing is the one and only way to safely reopen an economy. And what I'm hearing from folks every single day, and I know you are, I know everyone is we understand how serious this is, but when and how do we reopen? And what this really is about is us putting in motion the next phase of our response, which begins by trying to tackle really difficult supply chain issues and creating, hopefully, a context in which staff can have all the resources and tools they need to embark on that as seriously as they embarked on launching the One Buncombe Fund and raising $1 million for that way faster than any of us thought were possible. I never doubted staff. I just didn't think that was possible, and it's amazing. So that's really what's driving this. Again, if there's any specific questions about the data or the case studies, I'm happy to talk those through. I tried to include source links anytime data is cited. And it's basically mostly news reports of what's happening in different communities, from South Korea to a small town in Colorado, to data from our own county website.
I agree with Commissioner Belcher about one thing. It's uncommon. These are not the usual times, but it's times like this that our leaders and we as leaders, we have to step up. And I think one of the reasons that we're where we are in America overall is that we took too much time on the front end, and look at how many lives, over 30,000 people have died. On the other hand, in Buncombe County, I think we've been successful because we didn't play around. I have commissioners calling me from other counties across the state. They want to look at where we are so they can get here, because we really took the bull by the horns and moved. And I'd like to thank our staff, and I can't thank them enough for taking the leadership in doing this. But I think on this resolution, and folks, I've got two X's on my back. One, I'm 65 and over. Two, I'm African American. So this really hits home to me and the people I represent in Buncombe County, is that we have got to do the testing. We've got, and I know I hear from people every day, like all of us. I get the emails because people are suffering. You know, their money they are not being paid on everything, you know, and I can understand that. I know how they're suffering. But folks, we've got to do this right, and we've got to come out of it in the right way. And if we don't, we can create a bigger problem than we have now. And I know sometimes it's tough in situations like this. You've got to have the patience, but you also have got to be willing to roll up your sleeve and do what we need to do. And I disagree. I think this, when I look at this resolution, folks, a lot of it is just common sense. And when you look at the studies, you know, I've been reading on this every day. Now I'm at home, I can't run out. And I think we have, you know, what we're doing and what we've seen is fine. And I have a cousin that I just talked to this morning in L.A. who's very active in the government in Los Angeles County. And what they are doing, folks, is it's unreal, but unfortunately, I don't think they have even peaked out there on the curve. They have got a lot ahead of them. But we have got to act. And I think what I see here is something we cannot afford to wait on. We've got to act, and we've got to act on it today. And I agree, you know, it comes up. But in times like this, sometimes you can't wait, folks. We've got to step out. And, you know, leadership is that the heat is sometimes hot in the kitchen. You know, we've got to understand that. But I think we've got to move. We just can't. And the community is expecting us to show leadership here and to do what we need to do to come out of this. And this is what I see this resolution. And this is not something you can just open up and say, we're going to open this facility tomorrow, this the next day. And I know people are hurting, but we've got to test. We've got to know who we deal with. Because when I look at the figures from Buncombe County, I'd be the first to say they can't be true figures because we haven't done the testing. We don't know who out there is really still walking around with the virus. But when we get back to this resolution, this is something we need to do. And, you know, I got the information like everybody else did. But as I reviewed it, you know, I have confidence in what I've seen, what I see here, and I have confidence in the arrows that we need to give our staff to win this fight. So I will be voting for the resolution.
Hey,
Mr. Presley, yeah.
yeah, I agree, Commissioner Whiteside, we need to act. I think we need to do testing that's available. I think we need to see when the testing is going to be available and how many we can get. I also think we need to continue to plan how we're going to reopen this community. But do we have to sign a resolution in order to start these other things? It's a piece of paper. It's a resolution. Do we have to sign and say, this is what we've got to do before we can talk about it anymore? That's my question.
Well,
Because what happens with resolutions is that whoever wrote the resolution, if you have an issue with the resolution and you disagree with it and you try to get it changed, you can't get it done. You can't get it changed. I have tried that many times,
Yeah.
It's
My
very-
question,
it's
my
very
question is,
difficult.
do we have to sign a resolution
We
to
don't have
get
to.
started?
No,
Okay,
we
then,
do not have to, but let me answer why I think we should.
why we should?
Yeah, I mean, there's a lot of great work being done on this.
It is.
For obvious reasons, there's a great need for it. I think this is just going to be a very significant piece of this, right? And we've never had to do something like this before. You know, the countries, these other countries that we're mostly talking about, like have handled this better than most other countries around the world. Part of the reason, from what I've, you know, again, we're all reading stuff, trying to figure out how folks are handling it. Part of the reason some countries have had a better go of this whole thing than others is they've had other epidemics in the more recent past. Then we've never had anything like this, but they've had other bad experiences with it where they learned these lessons a decade ago, right? So they have systems for testing, and frankly, you know, some of the societies learned, all right, here's kind of what we have to do. If we had something else like this happen in 5 or 10 years from now, which I hope we won't, you know, we'll have gone through this before, but nobody in our country's had to deal with this since, you know, 1918. So, so I think this is going to be a significant part of the work. We don't have a plan yet. Basically, this resolution is asking for the creation of a short-term plan and a long-term plan. We've taken the budget piece out. Ms. Pender will talk to us in just a minute about some different things that we can consider investing in right now, but we don't know what this is going to cost yet. We're going to have to do the planning around that, but I think to me, it's a significant enough piece of work. I think it'd be beneficial for the county commission to say, we see this as a very high priority going forward on this. That's my reason why. But would work happen around this if we said nothing? Of course some work would happen around
Exactly. It's all recorded, and we're going to start finding out when they're available, who's going to get the test first, and I mean, our attorney or county manager, because we've already changed number 2 on the back here, took out, you know, about the budget, which we're going to talk about later. So the resolution's got to be redone anyway, right?
But why not pass the resolution if these are strategies that we think we ought to move forward with, and that set a clear direction, and also that communicate to the people of Buncombe County how serious we take this, that we are elevating this to be the top priority in our community, and that we're committed to short, mid-range, and long-term planning around it. Why not take the step to communicate that and to put that in place?
I
To take
think
that a
they've
step
heard
further,
that.
I would just be curious to know what you would specifically change. What is not sitting well, and what would your recommendations be? I'm willing to hear those.
Can I say something? First of all, let's look at the big thing. We are where we're at because of our citizens. They did what we asked them to do. And this is ever evolving, and we know it's fast. But the email that I got on Monday said we were going to come and discuss what Phase 2 looked like.
Absolutely.
This is not discussing what Phase 2 looked like. This is almost implementing what Phase 2 is going to be. I know that we have to test. I know that. We've got to do that. We also have got to get our economy going back again. For the mental aspect of our citizens, the long-term aspect they're going to have dealing with their jobs going and all that, the issue is, what is that testing going to look like? That's where I want to know. If you look, it says develop short-term and long-term plans for expanded COVID-19 community testing. What does that look like? Are we testing just those who can't afford to go get a test? If I call my doctor and say, hey, I've got sneezing and coughing, don't worry about it, just stay at home, don't come and get tested. Those are answers that we have to get, questions that we have to get answers to. And this here looks like it's already binding us to Phase 2, and we were going to discuss Phase 2 today. I'm all for whatever we have to do. And as it says here, it says we know that there's a shortage in testing. Does that mean that we're going to keep Buncombe County shut down until the shortage comes back? If that be the case, when is that going to be? Is that going to be June, July, August? Those are answers that we don't know. And I thought the discussion today was going to be more or less, what is the next phase? Are we ready as commission? Now, here's the thing. I've only been here about a month, and boy, what a month it has been.
Yeah.
But we don't, I hope that we don't do business where an email went out saying one thing, and then I didn't even know we had a resolution. I'd been from another commissioner, said, have you read the resolution? That's one of the things that I hope we don't do business that way. The second thing is, are we ready and prepared if the governor of North Carolina says we're going to start easing up? And are we going to follow him, or are we going to say no because this is what we got as our Phase 2, we're not going to do that? Those are answers that need to be are questions that need to be answered before we bind ourselves to what phase two is. That's my opinion.
Well, and we can absolutely talk about other aspects of, this meeting was convened to talk about where are we going on the COVID response issue. So if commissioners have other things they'd like to discuss regarding, ideas around that, we can absolutely do that today as well. As I've thought about those questions, because we're all thinking about them, right? I mean, there's just so much, there's so much pain that the environment we're in right now is creating for folks. But my high level response would be, I don't know the answer to those questions you just asked. Those are really important. I would definitely be looking to our health officials for what they think is the right thing for Buncombe County. I think they've done that carefully with each step we've taken, and I would certainly look to them for guidance around what's the right decision for Buncombe County to make on those issues. But the one thing that I just kind of keep coming back to, the one thing that we know is that we've got to do a lot more of this testing, whether we're providing more flexibility for businesses and public gatherings, or whether we're keeping it at the same level we have right now. Just the one thing that's just become crystal clear looking at this challenge is that we need the data that testing provides, and in the short term, we're going to be resource constrained around how much we can get. In the long term, it's probably going to be, very large scale. But we need to begin focusing on going down that path in a much more significant way, regardless of what the rest of what other aspects of what comes next look like, in my personal opinion.
So let's look at the resolution, if you don't mind, and maybe we can, if you look at number A, develop short-term, long-term plans for expanding COVID for community testing. So A, let's see what the community testing is. But then it says to include but not limited to frontline medical and first responder staff. So are we saying that we're going to try to prepare, were we going to test them, or their insurance company test them? If their doctors say don't be tested, what are those things? How's that going to pan out? Okay. I'll tell you, I think I would love, I would love for every citizen in this county to get tested.
Absolutely.
I would love it.
No question.
And if resources were there and the supply was there, I don't know if our CDC nurses would like to hear this, but I'd love to see everybody get tested and then say, okay, here it is. But we know that's not going to happen because some people have doctors who are saying, no, don't come to me, don't go get tested. But then when we inflate our numbers to say, well, we got 43 confirmed cases, but we know there's more out there. Well, then how do we know there's more out there if we don't test them? And then we know they're out there. We do know, but are we going to try to test everybody to get those numbers to be more in line? I mean, sorry, but New York just took 3,000 deaths and said we just assuming they died from COVID. That puts a fear in the people's mind that this is, and we can't do that. We can't go on assumptions, and we know that the only way to know true numbers is to test people. What is that community testing going to be like, and is it every citizen in our county that's going to get a test?
And that's, Commissioner Penland, that's what item A says, is to instruct staff to prioritize developing the plans around the testing protocols.
But do we need a resolution to instruct staff to do
With
that?
all
Well,
due
I think that might be a difference of philosophy. And that's okay. We have a few of those. We love each other anyway. I think I would, I see resolutions as one of the primary tools we have at the county commission level to really name where we're pointing the ship and where we're prioritizing the resources we have available to us. In this case, staffing resources and associated budgeting resources. And what's really at the core of this is saying we need to test more, and then we need to do the things that go along with testing so that we have the best understanding possible about the extent of COVID in our community, and we can as safely but also as quickly as possible reopen our economy and our community. And that's what this says and puts in motion, basically a framework that staff would use to expedite the planning process. If we don't do this today, I'm sure pieces of this will move forward, but there's a lot of other things that are in motion right now.
Can I make one comment on it too? And as I'm kind of thinking about this, why do a resolution? It's causing me to reflect on why are we doing a resolution. So one of the reasons I do think that this is valuable. Because there is a lot of work being done around all of this, right? From different, and there's doctors doing it. HCA's got some testing going on. Dogwood wants to go big on this. They want to do a lot. They're doing a lot of great stuff. But when I think about Buncombe County, and I think about the amount of testing that I think, based on everything I've tried to learn about this, as a policymaker over the last month, because I think we need to be doing more, and eventually quite a bit more. I mean, eventually, maybe everyone in Buncombe County does get a test. That's not going to happen anytime soon. Right now, we'll be doing great if we can get resources to these highest priority, kind of segments of the community. But part of what, after listening to all the different folks talk about it, is I firmly believe that Buncombe County has a very important leadership role to play in making this testing happen. I think as a country, we've kind of been saying, like, people want to get tested. It's like, we'll call so-and-so, and they call them, and they're like, we'll call so-and-so. I think for the places that are doing this, I think best, it has been local governments, or in some cases some state governments that have stepped up and said, we just need to make sure this happens. And we play the leadership role in trying to move in that direction, even understanding all these logistical constraints that are going to make it more limited than we would probably like for it to be ideally, at least in the short term. So,
So we took the budget part out of it. And I'm going to guess that number 2 was going to be, this was a kind of an ideal cost of what it would be, this would look like for this resolution. But since we've took that out, and that's going to be a separate part of business, and I'm going to tell you, the budget part is not the issue. The issue I got here is, so if we knew we were going to take the budget part out, and all this stuff was going to happen anyhow, then that's why I'm just not sure why we have. We see the budget amendment, and we know, is the budget amendment going to be to pay for the testing? Is that, so we know that's out now?
We could have some more information on that before we bring this to the vote, if you'd like to. But just for a little context on the process, we are kind of working on this, moving this ahead as we can. Originally, when this was drafted, I don't think we were aware that there were some other budget things that would be beneficial for us to take up today, related to COVID. So as we learned that, then that's the reason that, you don't need to put an appropriation here, because we're going to talk about that separately anyway. But we could learn a little bit more about that as well. So, Mr. Belcher, you had a question.
Yeah, I did. And so the reason that Commissioner Penland, that these resolutions are so difficult is that we tend to, if we don't agree with the whole thing, then we're put in a position. I know Commissioner Whiteside didn't intentionally do this, but he mentioned that these things require leadership. These things
I meant what I said.
I know what you meant what you said.
Okay.
And I just hope it wasn't directed in my direction, because it takes a lot of leadership and a lot of heat to not go with something that you just are not comfortable with everything. So it does take a lot of personal heat. It does take a lot of leadership to be able to do that. I don't take away from those that worked on this. Commissioner Ferrara knows this, and this is a very accurate statement that we, from time to time we'll disagree on resolutions, but on the big picture of things we don't. We treat each other with dignity and respect, and that will continue. However, I don't know why I know that the county manager has, and that our health department has already been working towards the thought of testing and trying to find, how can we do that? Is it possible for us to do that? What are the resources that we can do that? And so I think we all support that. I'm just not comfortable with everything in the resolution and the way it was, presented. I'm okay with making last-minute decisions, but there's other ways to do this, I think.
So Commissioner Penland expressed some concerns. I'm still waiting to hear what specifically bothers you. Like, can you
He told
zero
you.
in on
He told
anything
you.
else?
He just told
That's
you.
it. That's all. That's it. That's
It's
what's
two
holding you up.
phases. It's two different things. Short-term, long-term. Are we gonna do long first or the short term first?
Well, and the other thing too, Chairman said it, you know, and Commissioner Penland, others have said it, is that, you know, what other things were we planning on discussing, you know, today? Was there other things that we need to discuss? Because people are asking, you know, how do we protect the most vulnerable? How do we, you know, are our nursing homes secure? I hope they are. I get that all the time. I want to know about that. I think that maybe in some areas, people have struggled with that decision, and I'm very careful to not put people in making a right decision and a wrong decision here, because I think people are just trying to do the best they can in their lives, you know, in the balance. I think that people are questioning me on why, you know, you can go into a big box retail store, you know, and it's okay to go in there with, you know, 500 people, you know, that has and they put lines on it, and it's not okay for me to take my child to a toy store that's half as big as this building, where there might only be 5 people in there, and I could go in and walk through and take that time to be able to go and do that. And so that's a small retail, small business comparing to these larger retails, you know, and how do we look at that? And how do we look at some things that make sense? And I don't think we can just do that at the county level. I've talked to, you know, people from the state, you know, 2 or 3 times, you know, this week, and trying to find out where is the you know, the House and the Senate and the governor and all of them, where are they at? What can we expect to come our way so that we can make good decisions when it comes here on, you know, do we want to align ourselves specifically with the state guidance? You know, Buncombe County, Mecklenburg County, you know, some county, I mean, we're different than other counties. One of the things that makes us different, and, you know, everybody knows it, you know, is we have an airport. We have.
So there's a part of this resolution I'd like to draw your attention to, because I think
All right.
you ought to like this.
Oh.
Part of what it says, you know, I think, you know, and this is all pretty high level. I mean, it's not, I don't think it's, you know, micromanaging this. It's really talking about a planning process. But, you know, it does talk about, I'm sorry, I just lost my place. Item G, you know, developing protocols for utilizing testing as part of an overall plan for safely reopening the economy and community. So that is part of what I think we're trying to kind of, and again, our staff are doing a great job. They wake up every day and they work hard on this. But I think as we're trying to, you know, for the community and in terms of prioritization of finite resources, try to help articulate how is this process going to work as we move forward. You know, we do need those protocols. We need to think about, and again, you know, every state's wrestling with this. You know, there might be some direction, more direction from the federal level, or might not be. We just don't know yet. So we have put in place these protocols, and you know, and it seems pretty clear there's not just going to become some date on the calendar where everything goes back to normal. We know it's going to be, you know, a business sector by business sector approach, where some things can start happening sooner than others. Some kind of public gatherings will become, you know, allowed before some kind of big events are going to be allowed. We know it'll be kind of an incremental process. And so there will be that kind of process. You know, I don't think we're going to figure out all that today. We're going to be getting recommendations from the health staff around those different ideas. But, and again, not to just kind of reiterate this, but part of, as I've thought about this question, it's part of what I just keep coming back to. It's like, we know we have the remainder of this month where we're under a state order, even if we had no order in Buncombe County. And many people believe it's highly likely the state order will be extended, you know, into May. For how long, no one knows for sure, but that's pretty likely. So to me, all the more reason that one of the things we can be doing in the interim is starting to think about how to do expanded testing, because it'll be valuable under any of these scenarios. So rather than kind of like, what can people do, or we as a community do while we're staying at home, staying safe, waiting for, you know, changes at those bigger levels, this is one of the things. I think there's some really important planning work that needs to be done around.
And for me, I think it makes sense. I know it says short and long-term plans. I don't think those can be done in silos. I don't think you develop a short-term plan and then a long-term. I mean, I think those are often thought of in very parallel ways that often cross and intersect with each other, that you're looking, okay, long-term, but to me, they go together in many ways when you're working on a plan. I think this could even be taken further. I mean, one thing we haven't addressed is, okay, let's say we do these things and we start to loosen restrictions and we see an increase in COVID-19 positive tests. How do we start to pull back? Again, I mean, to me, that's missing, and maybe that's going to be part of the short and long-term planning, is when do we have a trigger that says, ooh, we've gone too far in loosening these. I think our community is looking to us as elected leaders, not elected officials in this time, and that means making hard, as I said last week, gut-wrenching decisions that may in the short term may not be a popular decision to make, but we know that we're saving lives, and that's what this is about.
So, Commissioner Edwards, I would agree with you on your last point as to part of our discussion needs to include that, let's say that the state, at the state level, that they decide to take small retail and apply the same restrictions as large retail, which is, 5 people for every 1,000 square feet, and they decide that at this time they believe that is safe if it's done, with proper distancing, and they have ways where they have, put that out, and it seems to certainly working at the grocery store that I go to. But so what happens if we do some of those things and it ticks back up? We have to have the ability to be able to either back up to a previous order or pull back. And I think that those are things that we've actually had discussions about, maybe as individuals and as we think through this. I think increasing testing, if we have the ability to get it, the test, is not a bad idea at all. But I don't think it's inclusive of everything that we need to do, and that discussion would. I thought that's what we were going to discuss today, and direct staff to do or look at either aligning ourselves closer with the state and some things that are forthcoming or currently, and seeking outlets for testing, developing costs associated with those testings. But all I'm saying is that we have been able to do this in the past without creating a resolution that makes us either stand on one side or the other to be able to do it, which we shouldn't have to do, to be able to just direct staff to seek out testing, costs associated with testing. How much would it cost to test all of our nursing homes immediately? How much would it cost to, have tests available for X, Y, and Z? Because I believe staff's already working on that already, way ahead of us.
And I believe
for this resolution, way ahead of us.
I strongly believe, as in leadership roles, you're always looking 2, 3, 4 steps ahead of where you are. And this particular piece on what happens if we have to pull back, that's part of that steps 2, 3, and 4 ahead of where we currently are with this particular resolution.
But we need to, my point is that we need to be discussing that now.
And I'm not saying we shouldn't.
What we're talking about is saying that we want to do a resolution for testing based on X, Y, and Z, and we don't know how many tests, we don't know how.
I guess
Well,
what I'd like
obviously,
to,
I wouldn't have recommended it if I didn't think it needed discussed, but I think for the purpose of today, this is a short-term resolution, and I think there will be additional steps that come before us.
I just want to make sure that our citizens, if they're watching, they understand that there's not one commissioner up here that doesn't realize that, hey, we need to reopen our economy. We need to do that safely, and it's not based on whether or not we support or don't support a piece of paper saying that. The thing is that we all agree upon that.
That's right.
And we've got to do it for the long-term health of our citizens and our county. The issue at hand is the fact that, yes, this is phase 2, this is phase 3, and I believe that maybe, just maybe, our staff has done a great job. I mean, not, our entire staff, Dr. Mullendorf, Fletch, and those folks.
Absolutely.
I'm telling you, they need, that's another discussion, what they need. But the thing is, though, is we have to make sure that we as commission are a part of this. So if today we would have been talking about phase 2, and then we put that wording into a resolution, if we had to meet next Monday to pass the resolution, then that's it, because if we know we're in unprecedented times. Well, what's phase 3 going to look like? Well, this is a commission. These are questions that we're being asked. When are you going to open up the dog parlors? When are you going to do this? Well, if you look at this, it's not until we can figure out how to test everybody, or at least have community testing, and how long is that going to take? Those are things we don't know, but those are questions that we are getting. And so I just think that we as a commission, yes, we should have been able to discuss today, let staff go out, see what that comes back, what that might look like, what that might cost. Then we look into the next phase, we look into the next phase. And if we have to meet, have an emergency meeting every other week, I don't know what that does, but that's things that we should be doing. But just because one of us up here doesn't support this resolution does not mean we don't support reopen the economy and being the leaders that we want to be, and making sure that the quality of life for our citizens is protected, whether it be for the COVID-19 testing or making sure that we have people who are getting their jobs back. Their quality of life is our ultimate goal. However how that looks is where we got to be focused, whether we support or not support.
And I don't think anyone is suggesting that. I 100%, 110% know where the hearts and intentions of everyone on our commission are.
Right.
We are paddling through very, it's classified rapids. It's a crisis situation. And there are moments when you have to make kind of decisive decisions about which way to paddle. And to me, we're at one of those moments, just as we were a month ago when we could have instated the local state of emergency on a Tuesday, and instead the timeline got accelerated to a Thursday. Again, I learned about it on Facebook. I'm fine with that. That's what needed to happen. It was the right call. Similarly, our staff has done a tremendous job anticipating how quickly we needed to move on implementing stay-home orders, and keeping us, frankly, a few steps ahead of many communities, many other communities. And I think that's benefited the residents of Buncombe County. And what this does is says this is a direction we're heading in. All the data we see from around the world shows that increased testing and the protocols around that, increased contact tracing, access to isolation are really not just the best, but potentially the only way to quickly and safely reopen the economy. So it feels important to me that we say that, and I don't think anyone is second guessing the motivations. I think what it seems like is we just have difference of opinion about the use of resolutions and some concerns about process, which I hear. And I own, I certainly worked on some of these materials and again was working on them up until basically I came over here. So that's kind of, I think the last comments I'll make on that.
I'm not going to disagree with you. The thing is, though, shutting down the county at the beginning, if we learned about it on Wednesday and it happened on Friday, that's different than trying to reopen and make sure we're doing testing. There could have been a better process with this. The emergency of shutting this county down, I'm telling you, that's totally different than what we're talking about here today. Preventing that spread and shutting the county down was something that had to be done right then. But now we're talking about, are we saying we are not going to reopen our businesses until we can prove that we have community-wide testing? Is that what we're saying?
We're saying we're gonna reopen our businesses when it's safe to do that, and the only way to know when it's safe to do that is to significantly increase access to testing and contact tracing. That is the only safe way to do it. And if we want to quickly reopen our businesses, then we need to, as quickly as possible, begin the planning process on how to get local tests available at the scale and volume we need. So that's what this is saying, absolutely, is we cannot safely reopen the economy until we've conducted the testing to have sufficient data available, and we can't get the testing available until we are making that our top local priority.
Right,
Let's go bring back my original question. Who's being tested? And if my doctor says, I don't want you tested because that's just the way it's going to be, are we going to sit here and keep this economy shut down because we have our medical professionals saying, these are people we want tested, these are people we don't want tested.
Let's stop for a second. When you are everything about public health and medicine says if you are symptomatic for a condition, the first thing that would happen is you'd be tested. Now, we've been operating under extreme conditions where we haven't had access to testing, so medical professionals have had to make wrenching decisions about how to create narrow enough criteria so that those most likely to be sick or sickest get testing. But every doctor you talk to, every public health expert you talk to would say, if there is a way to test, we should. And that's the premise of this. So what doctors are having to say right now is we can't test, so we can only test this narrow population of people. And what this is about is moving as quickly as possible to a time in our community when we have access to the volume of tests and the type of tests that we can be testing, ideally, all symptomatic people to start. And then we see in other parts of the world that they've had the volume of tests that they can move into testing asymptomatic people too, to determine if they're carriers, and then also the antibody testing once that's available. To me, it's sort of like if we are in an emergency situation, and we know we have to make quick decisions about what happens next, and this is about elevating this and saying this is what we need to be focusing on first and foremost.
And one other thought I would share, again, it's going to be a long time before we ever get to anything close to an ideal testing kind of system because of the supply chain shortages and things like that, and the technology not being anywhere close to perfect, things like that. So we don't have to get to perfect before we start opening up different parts of the economy. Again, I think this will be an incremental process of scaling up testing. I think the resumption of business activities and school and community things will also be incremental. I think there are some things that, based on our mercifully low numbers, I'd probably be comfortable supporting expanding soon. But I think for the broad reopening of community activities and business, I just think this is so essential. I mean, just before I came over here this morning, I read about I can't remember which one it was, but one of the airline companies is requiring testing every passenger.
Every passenger,
right?
yeah.
So, and let's just think about how logical that is, right? They're testing every passenger. So it costs a little bit of money to do that. And I come from a family of airline pilots. My dad's a pilot, my brother's a pilot, my granddad's a pilot. I would not go put my family on an airplane right now. Would you fly on an airplane right now? Would you get in an airplane and fly across this country for 4 or 5 hours in a constrained, space, not knowing, are there other people in this plane that have COVID-19?
Absolutely
We
not.
will absolutely, whether the government says planes can fly or not, and the government's never said planes can't fly in this country, that industry has been destroyed because we don't do testing, right? And who is going to go out and eat in our fantastic restaurants in this community if they're wondering, God, I wonder if the people who work here are they sick, right? And they might have COVID-19 even though they feel perfectly healthy. I just firmly believe that this is so important to opening the economy back, regardless of where the government restrictions are. The studies right now show that even in the 10 states in our country that have not put one restriction in place, things slowed down there after other places because they didn't have the local or state government saying, "Hey, folks, we gotta stop right now. We've got a big problem." So it's slowed down on a different rate. But even the 10 states that don't have any government restrictions, you go out and do whatever you want, business is down 70% because people are smart and people are scared and people know that it's right now it's taking a risk to go out to eat or to go to church. And until we start getting this testing right, just the county and state could lift our restrictions tomorrow, and the restaurant industry of Buncombe County will continue to be devastated. This is a big part of the pathway forward, regardless of the regulations, is my view.
Brownie,
And it's just been one of these places where we as a country have not gotten this right yet. I mean, the recommendations that have come down have been wrong, and it's been up to states and communities to say, that's not right. We've got to do it differently on this. Yeah. And I wish it wasn't that way, but that's just the situation that we're in.
Right. But I guess my question, and only question, is this right here gonna start our county community of going forward? This right here, of signing it, if it's 6-1, 5-2, 4-3, or whatever, it's gonna get passed if we vote on it, which we can't vote on it because the motion did not say to take number 2 out. So it's gonna have to have a new motion to do that because.
I thought I said take number 2 out.
No,
didn't I?
you did not.
I didn't?
No, you did not.
I did when I read it. So
Well, that was not in the motion.
Let's go back.
Right,
We can-
okay.
We'll look at that detail.
Oh, I'll make another
We're
motion.
talking about a lot of different things.
You can amend
I
my motion.
suggest that we go, my suggestion is this resolution is a piece of paper, just saying what we want. And our staff, thank you, a great job from way more than what was ever expected. Thank y'all. But let's let our staff, they've heard all this, bring something together for us Tuesday, for us to say how many tests are going to be available next week. The elderly, the first responders are going to get first choice. Our idea is to open, as in, I think Commissioner Belcher said, 5 people per 1,000 square feet building. You know, that is, and I don't want to say this wrong, our staff is very talented in every aspect of the work you do. You've heard our concern. Now you should bring that back to us for what we're going to do, and not a resolution, because a resolution is what's going to happen. We sign one, then as a board of 7 people are not going to continue on with what is in here. There's too many different things in here. And that's where I'm at, and I really would like for staff to take note what we've said, and Tuesday, or if we have a meeting Saturday, I can meet every day. I know we need 48 hours, but now we need to let our staff decide what is next on us. Signing your name on this and saying it was 5-2 or whatever is not getting it started.
So is that, why wouldn't that be possible, Chairman? I mean, that's not a, you know, we've had a pretty good discussion on this, and it's really all been around the fact that it's a resolution, and that there's some concern about Section G, where it does say that testing could be a requirement for reopening a business. But if we took some of this information and staff came back and said, hey, here's what we're recommending, here's what we'd love to see, here's what we're hearing from the commission, we think there's this cost associated with it, why couldn't we do that?
So there's any number of different ways things can be done.
Sure.
Right? And I think we just, I'm genuinely surprised that there's not agreement on this. I thought there would be. So I got that wrong, and you know, live and learn. I just did not think that a resolution supporting expansion of community testing on COVID-19. I just didn't see that being controversial. So this is one way to do it. Of course, there's other ways to do it, but we're here today. I think several of us have made the case for why we think it's important to do it. Y'all have made the case for why you'd prefer a different process. And it's okay to agree to disagree. You know, we're
Right.
a democratic process. We can, you know, if we don't agree on things, it's all right. We can vote and we can move on. But I still do. There's a motion and there's a second on the table to approve the resolution. For clarification, for the people who made the motion, does your motion include the number 2 budget item or not?
No,
Okay.
no.
Okay. So for clarification, that's not part of it. I explicitly said that when I read the resolution, that's.
Yeah, but you
That's
read it,
different.
and Commissioner did not exclude that, I don't think.
Well, I'm
Make a
gonna,
friendly amendment to the motion that we would exclude number 2 from the resolution.
And we accept it. I accept it. Yeah.
Yes.
okay, they accept the friendly.
Now we're doing it right.
Got it.
Okay, all right. Before we vote on it though, I do want, just so we all have the information. So Avril, could you tell us about, and we're not gonna, we'll vote on this and then we'll vote on the budget amendment, but just tell us what's included in that so we'll have that information as well.
Jennifer, she has the details. And Max, there's a presentation if you'll bring it up, please.
Or is it President?
So as Chairman Newman referenced earlier, staff did have plans to bring forward a budget amendment for the upcoming Tuesday meeting. Due to the relevance of today's conversation that was brought forward, but what we do want to provide to you today, before we get into the details of that request, we wanted to provide you with an update with regard to the prior appropriation of $500,000 on March 17th for expenditures that were related to COVID-19 response efforts. As of the end of business yesterday, there is $468,492 that has either been obligated for spending or has been spent out of that $500,000 appropriation. So that's 93.7%. Wanted to be able to highlight to you some of the primary areas in the categories of spending or obligated funds. As you can see, medical supplies includes personal protective equipment, respirator equipment, and fatality management supplies. Professional services is 2 emergency operations center coordinator contracts. Office supplies, some of the primary elements of that were radio communications, washable face masks, gowns, sanitizers, disinfectant wipes. Non-food office provisions was the U.S. Foods order for to-go containers and bags for schools, additional disinfectant and gloves. And then the office food and provisions has been for isolation and quarantine meals and EOC. So just wanted to provide you all with an update. So given the status of that current obligation or spending, our plan was to come forward to make the request of you for an additional, in the budget amendment outlines $500,000 toward continued preparation and planning towards the pandemic response for emergency operations. So that's the first item that is proposed in the budget amendment. There is a second item. I'll be glad to move forward with that if you all don't have any questions related to this or comments. So the second,
I do. So this is documenting how funds have been invested, and thank you for that. So in terms of the additional funding, it's not like a detailed line item because, again, we're kind of moving into this arena where things are coming up. We're having to be adaptive and invest in things that we identify as being beneficial to COVID response. So just to kind of say out loud, we are kind of giving pretty broad discretion over how to use it, in the context of the COVID-19 response efforts.
and that definitely would have been, our original plan to come in with that generalized overall request so that we, aren't tied to specific expenditures so that we can continue to do planning at our best. And I would certainly leave that to your discretion today if you wanted to, specify a certain amount of money out of that $500,000 for any specific items. We can certainly take direction on that as well.
Okay. No, I personally, again, it's kind of like we have to do things a little bit differently. Like what makes sense to do now is not what makes sense to do during normal times. And right now, I think the flexibility is very much warranted, just so that we can be responsive and adaptive based on what opportunities and needs come up. So I'm certainly comfortable with that. Any other? Okay, great. Well, thanks for clarifying that. So
Sure. So the second portion of the budget amendment is a dollar amount of $232,800 for consideration for the purchase of a new ambulance. As part of the fiscal year 21 budget request, Emergency Services requested 2 replacement trucks. In recent weeks, 2 ambulances have been unexpectedly out of service due to mechanical issues. This, coupled with a need to be as prepared as possible for potential increased volume necessitated by pandemic response, we are requesting to purchase one of those ambulances now. Current estimates for the new ambulance delivery, for a new ambulance purchase, could be anywhere from 6 to 8 months. Our Emergency Services Director, Taylor Jones, has been able to locate an ambulance that has been a demonstration-only ambulance at a regional dealership. So that's the second portion of this request for a total dollar amount of appropriation of $732,800.
Thank you very much. And so around planning efforts, around testing, there's not a specific line item for it. But if we appropriate these additional funds, and there is a need for whatever financial resources to do some additional planning or even to take some additional steps, then those funds would be eligible for that. But they'll be addressing a broad array of
Correct.
needs at the county level.
Yes,
right?
sir.
Okay, thank you very much.
So Los Angeles was for 20,000, it was 1.25 million.
Yes, they sourced it directly from a South Korean company at that cost.
Boy, they know how to charge.
So about $60 a test. Yeah.
And that's
And
what
that's
we've been paying.
I'm sorry.
Go ahead.
That's comparable to the cost per test in the neighborhood of between $60 and $70 per test that we see domestically.
And their plan is to ramp up from there. Of course, it's one of the largest cities in the world, so their scale of need is completely different than what Buncombe County's scale of need is.
They're
But just
planning, oh, I'm sorry.
Go ahead.
Yeah, they're planning to order, I think, an additional 100,000 tests per week moving forward. So, just
All right, commissioners, I think we should just go ahead and vote on this. Look, there's going to be more plans that will come to us, and we'll be able to review those too. This is not the end of this conversation, this is part of it. I appreciate where people are coming from on this, even if we don't land in the same place on it. I do. So I don't mean to feel like this is a black or white issue. But are there any other comments before we vote on the motion?
I would like to make a comment, please. I want to make sure that everybody understands, I am not against testing. I am not against community testing. I know we need it, and I know we got to do this. The only thing I'm concerned about is the way it's written, who's testing who's responsible for testing folks who are going back to work, and is the burden fall to the county to pay for the test, provide the test? Those are the questions that I think we should have tried to somewhat answer before we went into something like this, because that leaves us wide open to saying, well, I'm not going to go into a restaurant unless somebody's tested. Who's doing the testing? The people who own the restaurant, the insurance the people may work for, or is the county going to do it? And if it's us, is the funds there? So I want to make sure it's clear. Not against it. I just don't think that we know the true answers to some of our questions.
So Chairman, can I take a shot at a friendly amendment?
Uh,
Are we still procedurally open for that?
You can
Ms.
try.
Farrar, are you ready for this?
She didn't make the motion.
actually,
He didn't make the
Commissioner
motion, I
Whiteside
did.
holds this.
Mr. Whiteside made it. Are you ready for this?
Propose a.
I'll listen,
amendment
but that
and,
doesn't mean I'm ready for it.
See, that's what I thought, but I'll go ahead and take a shot at
Okay.
it. But since I know you're so flexible, Commissioner,
No, I'm not,
I
but
keep
go
looking
ahead.
at- yeah,
Look,
Commissioner
let's be
Whiteside.
honest now, you know.
But I know you're gonna have an open mind when I read
Yeah.
this, okay? So what I would be willing to completely support, okay, is if the resolution, talking about expansion of community testing for COVID-19 included for the whereases, okay? We get a little crazy with whereases when we write resolution. It's one of the things I don't like about them. But whereas, paragraph number 1, whereas the COVID-19 panic poses significant public health risk with more than 640,000 documented cases in the United States and more than 30,000 documented fatalities. Second, whereas the elderly and individuals with chronic conditions are especially vulnerable. Skip down 2, whereas the economic impacts of COVID-19 pandemic has resulted in more than 10,000 local residents in Buncombe County losing their jobs. Skip down to the bottom, whereas the Board of Commissioners seek to restore operations of local business sectors, community organizations, schools, and other educational institutions as soon as possible when it can be done in a safe manner, and community testing can be an effective component in that process. Then on the back, keep items A, develop short-term, et cetera, protocols, plans. Item B, develop protocols regarding tests, et cetera. C, prepare strategies to secure access to antibody testing. And F, expand prevention and early detection efforts among high-risk individuals. And H, seek collaborations with entities including but not limited to NCDHS, et cetera, and I would add private sector in that, in number H. And that would be my friendly amendment, and I would support that in its entirety. Respectfully submitted to Commissioner Whiteside.
So what you're doing in essence is changing the resolution.
Yeah,
Yeah,
that's all.
I don't accept it.
Okay. That's my problem I have with resolutions.
Well, I mean,
And I will make it, I also,
So would,
I am totally supportive of everything, but when we cannot compromise, I want everyone to know, I want us to go back to work. I want us to be safe. I want us to be tested. I want everything. But this has turned into a political deal. I support it all, but I will not vote for it because if we cannot come to conclusions that a piece of paper, a resolution, is going to keep us going forward, we're in bad shape. We are in bad shape.
All right. I'm not going to make any last comments. Let's just vote. All right.
Yeah.
All in favor of the motion, please say aye.
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 Those opposed?
no.
All right, it passes 4-3. All right, thank you all for your input on that. All right, let's go back to the budget amendment.
Yeah.
Are there any additional questions? We've got the information about it. Any questions about the budget amendment?
Just a comment, and then I'm going to make a motion to support the amendment. The ambulance, that's the one that we discussed last time.
Yes, sir.
That, I don't remember what happened, why we couldn't do it the last time, but I was in favor of it, and I think that we have an opportunity to acquire one and save some money. I would certainly like to hear from Commissioner, Penland about that, about the ambulance, but if I recall, at our last meeting, that was brought up, and we had a good discussion about it, so.
Yeah, I believe this is a demo ambulance out of West Jefferson, North Carolina. If you've ever been into the business of building out ambulances and fire trucks, it takes a long time to get those things. So anytime you could get a demo, I believe this is actually going to replace two ambulances. Well, we have two ambulances right now that keep breaking down. And one of those ambulances, I believe, is a diesel, one of our old diesel fleets. So I think this is to help replace those. That's really, I think that's all. Is that right?
Yes, sir.
So, yes. So I would support this.
Is that a second,
wholeheartedly.
Mr. Penland?
Yes, I could
Commissioner
second a motion to support both the budget amendments.
Okay, there's a motion from Mr. Belcher, second from Commissioner Penland, for a budget amendment of $732,800 total. Any further discussion? All in favor, please say aye.
Aye.
Any opposed? All right. Ms. Pender, I don't believe there's anything else we needed to cover today.
No, sir, just a reminder that we have the 2:30 media briefing, and then after that, the question and answers.
Okay, all right. Thank you all. This meeting is adjourned.
Where's the media briefing at?